This is Dr. David Stoker, board certified plastic surgeon in Marina del Rey, here to talk to you about septoplasty surgery for deviated nasal septums. Deviated septums are one of the most common airway complaints. If you snore a lot at night, if you have difficulty breathing through either nostril, if you're a mouth breather, if when you exercise you're getting inadequate flow through your nose, if you're frequently congested or using excessive nasal decongestants, any of those may be indicators that you have a problem with your nasal airways, and one of the reasons for this is a deviated nasal septum. What that means is the midline structure on your nose that separates the left and the right nostrils is deviated to one side or the other, and frequently it can be S-shaped where it actually obstructs both sides on the inside. Fortunately, there are surgical solutions for this problem. First of all, we want to rule out that there is not a component of medically treatable conditions that are contributing to the airway obstruction, things such as allergies. So we'll want to try you on an antihistamine and maybe a nasal steroid spray to make sure that an easy solution like that isn't enough to solve your problem. If that isn't enough to solve your problem and you have the appropriate anatomy, we're also going to want to make sure that you may not need other procedures as well, such as turbinate reduction surgery. The turbinates stick out from either side of the nasal airways on the inside to warm and moisten the air. Sometimes they get enlarged. And some patients have narrow internal valves in this area, and they need to be widened on the inside with a technique we call spreader grafts. You need an expert in nasal surgery to understand the significance of each of these. A septoplasty operation in this airway surgery doesn't necessarily need to change the appearance of your nose at all, unless your nose happens to be very deviated on the outside. Many people who have deviated septums have a perfectly straight nose on the outside. It's a procedure that's well tolerated with minimal bruising. Typically, you can be back at work within a few days following the operation, and it typically leads to a permanent, dramatic improvement in airway. In my experience, even when we're doing cosmetic nose surgery at the same time, patients who are all of a sudden able to breathe really well through their nose are so elated by that the appearance of their nose becomes a distant second place in the significance for them. It leads to a lot of patient satisfaction and makes it fun for me to help people with this problem. This is Dr. David Stoker, board certified plastic surgeon in Marina del Rey, California, talking to you about deviated septum surgery, otherwise known as septoplasty. I look forward to meeting you in person.